Have you ever heard of Mast Cell Activation Syndrome, or MCAS, MCAS for short? This condition was only recognized by the medical establishment in 1991 and given a name in 2007, so it's fairly new so far, and not many people have heard of it. MCAS is really a part of cluster of conditions known as dysautonomia, which refers to the dysfunction of your autonomic nervous system. And some other conditions in this cluster are chronic fatigue syndrome, chronic Lyme disease, POTS or postural orthostatic tachycardia syndrome, fibromyalgia, gastrointestinal issues such as IBS, gut dysbiosis, food intolerances, neurological symptoms such as restless leg syndrome and narcolepsy, immune disorders such as multiple sclerosis, severe or recurring infections, psychological issues like ADD, panic and anxiety attacks, stress, chronic insomnia, obsessive compulsive disorder, hormonal issues such as fertility problems, acne, adrenal gland problems, and adrenal fatigue, weight gain, thyroid disorders, as well as renal disorders as well. Now, all of these health problems seem to be related, and that's why they're a part of the same cluster. And they all tend to have similar symptoms, such as headaches or migraines, rashes or hives, stomach problems, such as constipation, diarrhea, or bloating and abdominal pain, weight gain or weight loss, fatigue, generalized malaise, muscle aches, food sensitivities and allergies, hormonal imbalances, and brain fog. When you have MCAS, it also means that your mast cells are overactive. Now, mast cells are a type of white blood cell which is part of your immune system. They actually originate in the bone marrow. And when mast cells are triggered, they actually release histamine as well as leukotrienes. These released molecules actually cause allergic or inflammatory responses. And the trigger for mast cells can vary from person to person, from individual to individual. Some of these triggers can include smells, infections, food and beverages, exercise, certain drugs, certain supplements as well, venoms from animals such as bees, spiders, wasps, stress, and exercise as well. Now, the chemicals that mast cells secrete are an essential part of your body's defense system. So, histamine is actually what's needed for your immune system to fight off these allergens, to fight off these things that you're reacting to. However, in MCAS, your mast cells are overactive and releasing them too much at a time at a constant rate as well. So remember again that this is when your immune system is being overreactive. This is when something that's supposed to be good for your body, however, at a chronic state, it ends up damaging the body. This can really cause uncomforting and distressing symptoms as well as health problems, especially for people who are going through MCAS. Now, the symptoms and issues that you experience with MCAS will depend on the variety and the type of chemical that is released inappropriately. But most common symptoms, again, are rashes, headaches, hives, dizziness, extremely dry skin, as well as really itchy skin. Now, you can have this itchy skin with or without a rash. Oftentimes, people present without a rash, but they just find this generalized itching that can be very, very frustrating. Alcohol sensitivity is a big one where people find that they are not able to tolerate as much alcohol anymore. Brain fog and irritability, especially after eating certain foods, where you find that your concentration is just not as good. You're not able to focus as much. You're having memory issues. That can happen. Gut symptoms, loose stools, diarrhea, constipation, or alternating as well. Too often, people are experiencing loose stools and they think that's just normal. However, that's not normal. This is your body's way of telling you that there's something underlying going on. Flushing in the face and in the neck due to food, heat, or stress. Sometimes nighttime awakening and insomnia can happen. And acid reflux, GI symptoms, again, like I mentioned before. Now, there's no known cause of MCAS. However, if you are suspecting this condition, you need to see your doctor for testing. With blood and urine tests, your doctor will be able to eliminate other causes and identify if MCAS is the root of your issues. Once you've been diagnosed, there is no known way to really rid yourself of this condition, unfortunately. However, there are many things that you can do to mitigate the symptoms as well as reduce your symptoms. The most common clinical approach is to really just take medications like antihistamines, which can help decrease the allergic response. Take cromolyn sodium, which is also an anti inflammatory agent, and ketotifen, which is also an antihistamine and mast cell stabilizer. There's also some things that you can do at home to really help with symptom reduction, such as avoiding foods that are high in histamine, such as shellfish, fast foods, sugar, smoked meats, pickled or canned food, and artificial coloring, as well as preservatives. You want to eat more foods that are low in histamine, such as fresh fruit, fish, chicken, and meat. Talk to your doctor about anti-inflammatory or antihistamine supplements such as resveratrol, quercetin, bromelain, fish oil, curcumin, turmeric as well. Thank you for listening and hope that you learned something on this topic of mast cell activation syndrome or MCAS. If you'd like to hear more tips, make sure you click the subscribe button and like and share this video so we're able to help others on their health journey as well. Remember that we're here to empower you to take control of your health.